thank you for coming. I assume that because you're here, you're interested in hearts and heart health. So let me ask you, who here is worried about a heart attack? Quite a few. Okay. Stroke? Okay. Cholesterol in general? Some. Dying? Okay. And how about non-heart things? Stroke, not stroke. Dementia? Osteoporosis? Falling? Cancer? A lot of things. What if I could tell you there's one thing that can help prevent all of that? And it's free. And it's exercise. First thing to mention is the prevalence of inactivity. Really, about half of the country does not exercise at all. And this is 15-year-old data, but still over time it has not changed. Really, this is a country that does not exercise. And these are the effects of inactivity. Everything that we just talked about, from atherosclerosis in terms of coronary artery disease or blockages of your arteries, to even the more basic things, high cholesterol, inflammation of the arteries, insulin resistance, diabetes, obesity, high blood pressure. And then all these things feed back on itself and cause more inactivity and higher risk of heart disease. Usually the first answer I get when I talk about why don't you exercise, it's I'm too busy. And this is going to be my response. Would you rather be dead or exercise 1 hour a day? Very simple, and hopefully by the end of the next 5 minutes I can convince you of the truth of this. So, a study of over 50,000 nurses, very simply, 1 hour a day of walking briskly reduced the risk of obesity by 25% and the risk of diabetes by 33%. If you instead took that hour and decided to watch TV, you would increase the risk of both obesity and diabetes. Simply sitting at work, which has become a hot topic, also modestly increases your risk of obesity and diabetes. Looking at cholesterol in 700 patients, these are undergoing cardiac rehab, so formal exercise training. Clear benefits in cholesterol. Total cholesterol goes down, LDL goes down, that's your bad cholesterol, and HDL, your good cholesterol, goes up. This is simply for exercise. This is not your Lipitor. This doesn't cost you a dime other than 1 hour a day. A Women's Health Initiative looking at over 70,000 women. Very simply, just a little bit of exercise decrease the risk of coronary disease. So what you're seeing in 1, 2, 3, 4, 5 is basically grading how much exercise that person reported as doing. And you can see just walking, not a lot of difference between 2 through 5, still a huge difference versus number 1, which is not walking. It only takes a little bit to reduce your risk of coronary disease. Looking at 13,000 men and women for 8 years, and again, fitness level from 1 through 5, you only have to get to a 2 to really reduce your risk, and this is now mortality. We've gone through diabetes, we've gone through obesity, we've gone through cholesterol, and now we're at mortality. Significantly decrease the chance of death by being somewhat active. Hopefully not too much to ask. These are patients with known coronary disease. You already have cardiovascular disease. Just a little bit of exercise decreases your mortality significantly. And so for those of you who we are very encouraging and strongly recommending and next to demanding that you go to cardiac rehab, this is why. It decreases your risk of death. So on the flip side, let's talk about what does exercise do? Well, it does the reverse of everything I just said inactivity does. So exercise decreases anxiety, depression, dementia, stroke, decreases mortality and coronary disease, which I just showed you, decreases some risks of cancer, decreases osteoporosis and falls, decreases weight and diabetes. It is a magic pill. How much exercise do we want? Well, there can be such a thing as too much. I'm not asking you to do too much, but some of our patients do. So if you are one of those, we ask you not to do more than 1 hour of strenuous or vigorous exercise a day. If you do, we ask you to take some rest periods and or cross-train with lower intensity. If you're not one of those patients, let's stick to the American Heart Association recommendations. 30 minutes of moderate activity, 5 days a week, or 25 minutes of vigorous intensity activity, 3 days a week, plus a little bit of strength training 2 days a week. And even if this is too much, 1 hour of brisk walking a day is all you need. I'll leave you with this thought by the founder of the National Institute of Aging, who says, if exercise could be purchased in a pill, it would be the single most widely prescribed and beneficial medicine in the nation, and free. Thank you.